community engagement. And this is a 3 days training, whereby there will be a lot of issues that will be tackled. It will cover fundamental and social determinants in terms of these communication systems, the planning and simulations, partner coordination, how we're going to be coordinating with our partners, the communication to the public, and also most importantly, the use of the social media in response to COVID-19 and other infectious diseases. We have to bear in mind that apart from COVID-19, we still have other priority diseases within our countries. So this will be generic as well as specific to COVID-19 as well as other infectious diseases. We have invited the risk communication and community engagement focal points within the continent, as well as other public health professionals in our networks. So most welcome, and let's have a wonderful 3 days. For starters, we have a Q&A function whereby you can be able to indicate if you have a comment or question. And also we can use the chat function just to indicate our name and the country that we are representing. We have interpretation in French. So choose both French and English. So use the interpretation button to choose your language. Well, we'll be having a number of presentations, and we'll be guided by our agendas projected here. After the introductory remarks, we'll have a pre-test to the training. Thereafter, we'll have an introduction to RCCE course by David. We'll have fundamental social determinants and context, David as well. And we'll finish with risk communication systems by Aminata. So what we'll do is we'll have the presentations in a row, then we'll have a discussion, and thereby we'll close the day. And tomorrow, we'll have, can I scroll down, please? Tomorrow we'll have a day one recap, and we'll also tackle the public communication, including the social media by Aminata. Then we'll have a discussion, and we'll now talk much in terms of the community engagement by David. And thereafter we'll have a discussion. And the last day, the third day, we'll have a recap of day 2, and Aminata will come in with partner coordination, and we'll have a discussion. And we'll finish off with a perception, miss or disinformation, and behavior change by David. Then we'll have a post-test and summary messages. Mavuto Thomas, the current chairman, chairperson of the steering committee for the Africa region. Without wasting much time, let me call upon Dr. Benjamin, representing Africa CDC, to give some welcome remarks. Over to you, Dr. Benjamin.
Thank you very much, Director of Program. Dear colleagues, participants, all protocol observed, I am greatly delighted to address this virtual joint risk communication and community engagement refresher training of experts as part of effort to find solutions to the ongoing COVID-19 pandemic and other public health issues affecting our continent. I wish to thank the WHO for the exemplary partnership, not only in the area of risk communication and community engagement, but in all areas of collaboration, not only during this COVID-19, but also during the other disease outbreaks in Africa. No one is ever fully prepared for a pandemic, outbreak, or disaster, whether natural or man-made, but the ability to respond promptly and appropriately using the existing mechanisms is highly essential to minimize the casualties. That is one of the reasons why we are having this training or this refresher to be able to mitigate the risks and the risk of casualties during this COVID-19. Risk communication is not something we should leave to communication experts alone. It should be of our interest to all public health professionals. This training will help in enhancing the capacity of those who are going to take it for the next 3 days. We need to build trust between health workers and communities. We need also to be transparent about the information we share with health workers and the communities about the vaccines. And as you know, the vaccines, especially the COVID vaccines, are in the center of the conversations for the last couple of months. I can assure you that as Africa CDC, we will do all it can to support the risk communication and community engagement in Africa. I wish to thank you for listening and welcome you to this training and wishing you also a fruitful deliberations. I thank you. Over to you, Director of Program.
Thanks so much, Dr. Benjamin. Indeed, I think we should be able to push the agenda for risk communication and community engagement in our continent. Moving on, let me request Aminata to give some remarks on behalf of WHO AFRO region. Over to you, Aminata.
Thank you very much, colleagues. Let me start by congratulating all participants that have set out some time to attend this meeting. Currently, we have 101 participants attending this meeting. This is really a good intervention. I want to thank Africa CDC for supporting this training. And I believe we have a fantastic relationship. And I hope that through this training, we'll be able to revise our strategies and build trust in the communities. Risk communication for me is the most important pillar to address every outbreak. We are there before the outbreak starts and we will continue to stay with communities at the end of the outbreak. Colleagues, let's do our best. We know we have the most difficult job to do, changing people's behavior. We are aware that information alone cannot change people's behavior, and we need to advocate for an enabling environment and for change of policy to make healthier choices easier choices. I hope that by the end of these 3 days, you will realize that you have not wasted your time. We want to thank the facilitators and thank the organizers. Have a good day, and we hope we'll have a fantastic time. Over, Mr. Chair.
All right, thanks so much, Aminata. And moving on, it's now time for a pre-test. I know people are dreading now this time around to say, what is it that I'm going to face now? So just to check on the knowledge, the current knowledge that we have, there is a pre-test, both in English and French. Let me ask Addis to guide us in terms of how we are going to do the pre-testing.
Thomas.
Yes, Mojo.
How are you?
Good, and how are you?
Excellent. Thank you. Good, well done.
Can you please mute your mics, please? Thank you.
Hi, colleague. This is Neka from Africa CDC. So as you see displayed on the screen, this is the pre-post-test evaluation for this refresher training, RCCE refresher training over the next 3 days. So we've designed this method in a way that we want to issue you a certificate after the training. So the pre-test is to test your knowledge about general concepts of that will be covered for the 3 days. We just want to know generally what your knowledge skills are in relation to the topics. Then at the end of the day, we'll have the post-test that will also help us to evaluate the knowledge, the skills you've gained within the 3 days, and how impactful it can be to our work in the local communities. So I want to believe that at some point earlier today, you received this pre-test questions or form, and if you can return that to us. But let me ask our senior facilitator, Dr. David Hewito, to maybe run us through this process, how he thinks is easier to work for us. Dr. Hewito, please take over. Thank you.
Okay, thank you, colleague, and welcome to this training. I would like to, because we have our colleagues that interpreting all we are doing. So I want to take the opportunity to speak for my people in French so that they can really very well master the thing. Actuellement, avec le pré-test là, vous avez une version française déjà, ok, que vous allez pouvoir, et comme ce qu'il a expliqué, c'est que vous avez reçu cela déjà très tôt ce matin. Si c'est le cas, vous allez bien vouloir remplir et renvoyer ça tout de suite avant qu'on ne commence. You've received already this pre-test, as the colleague said right now. So please, can you fill it up and send it right now before we start, so that we can compile everything and then compare it to what we will be doing at the end of the session, the last day. Thank you.
Thomas. Mr. Chair?
Yes.
I've tried to fill in the form, but it's difficult for me on my phone. I don't know. I don't know whether colleagues have, I don't know what are we going to do, or we just text it in the chat box or what, I don't know. I cannot, I don't know what to do.
I think David should be able to guide us.
So, sorry to interrupt, can I just help with that? So if you haven't received the Word version of this form, just put in your email in the chat. We will pick it out and send you the form right away. And if you have already received it and you've worked or you're working on it, we're going to put 2 emails in there from Africa CDC that you can immediately send the filled out form to, and we will receive it. So my colleague Addis will just put in an email that you can send the filled out form to after you have done it. And if you haven't received it, just indicate your email quickly and I will send that to you immediately. I hope that helps.
Also, please, you can also put the files on the chat box for them to download it. Please, that is also something they can do, actually. Those who haven't received it can actually download it from the chat box if you put it there for them.
Great. So our colleague, the IT colleague, will just do that immediately. So there are a couple of ways now you can access it. Either you can put in your email, or it's going to be posted. The form is going to be posted in the chat, and you can just download it immediately as we go along. Thank you so much.
All right, thanks so much for the clarification. And we just give it a little bit of a time so that people can be able to fill in the form once it is uploaded on the chat box.
I would suggest that we give 5 minutes more, and we can have until the break time for people to share their response. I'm looking at the time. Over.
All right, thanks so much, Aminata. I think we should be able to give it a little bit of 5 minutes more. And within the course, we should be able to receive back the answered word version of the pretest through the email address that will be uploaded. So we'll start again at 20 in 5 minutes time. That's 15:25.
Please, David, here to answer the questions, need to mark at the right side the correct answer according to your knowledge. You see, si vous voulez répondre, vous marquez juste à droite des les réponses sont correctes selon vous, parce qu'il y a une ou plusieurs réponses correctes à chaque question. Merci.
I'm still waiting for the question. I won't receive it yet. Don't know what is happening.
Yes, that's what I was going to tell people also, because we've not yet received the file in the chat box here, actually. Is it possible for the IT to do so?
Sorry, Nikawan here. Sorry for the brief delay. It's been uploaded right away. And my colleague Addis is also putting in the emails that you can use to send back the form once you finish with the answer. So the forms, both English and French versions, are going to be put in the Zoom chat icon. Thank you.
All right, because of time, I think we need to move on. We'll be answering the questions concurrently. I think we need to start. Let me request David just to give us an overview, an introduction to the RCCE course. And we should be able to use the chat function as we are progressing with the meeting. So over to you, David, to take us through the introduction to RCCE course. Thank you.
Okay, thank you. Thank you. So can I share my presentation right now? So okay, great. Okay, so my slides are in English. I would like to talk in, French or English whenever it is possible, So here is some just bullet point for you to know, to have an overview on what we called risk communication and community engagement with that acronym, which is FORCE. Donc, voici très rapidement un aperçu rapide de ce que nous entendons par communication des risques et engagement communautaire. En réalité, rapidement, à la fin de la session, c'est-à-dire les 3 jours, il serait intéressant que chaque participant arrive à définir ce que c'est que la communication des risques et décrit un peu comment est-ce que on a besoin de ça, pourquoi avant, pendant et après une urgence. Donc, ce n'est pas une question seulement d'urgence, mais c'est quelque chose qu'on doit désormais intégrer dans un processus entier de professionnels de la santé que nous sommes et de connaître les 5 principaux domaines de la CREC ou en anglais RCCE. En fait, qu'est-ce que nous appelons communication des risques? Il faut faire attention et ne pas confondre avec la communication tout court. Parce qu'on est habitué à la communication tout court et on a des experts, donc ce n'est pas à moi de vous parler de ça ici maintenant. Donc, la grande majorité d'ailleurs occupe un poste de cette envergure-là où c'est la communication. Mais ici, pour faire la distinction, prenez seulement le risque, pensez au risque. En situation de risque, comment on va s'organiser pour engager les gens? Donc, quand on dit communication des risques ou communication sur les risques, c'est essentiellement ça. Donc, on est en situation d'urgence, comment interagir avec les gens? Donc, c'est ça qui fait la différence. Donc, il s'agit en fait d'un échange, un échange qu'on a entre les experts que vous êtes, professionnels, et les autres de la communauté ou de la population qui sont maintenant victimes d'une situation d'urgence ou d'un dommage. Vous voyez? Et l'intérêt ici, c'est qu'on va le faire pour leur suivi, mais aussi pour leur bien-être social et économique. Vous voyez? Donc, ce n'est pas santé au thème maladie tout court, non. Mais c'est santé qui va au-delà donc de la maladie, parce que vous avez l'exemple de la COVID-19 avec tout ce que ça a donné, vous voyez, non? Et si vous ne vous intéressez pas à la situation socio-économique des gens, vous allez échouer dans cette interaction-là que vous allez avoir avec la population. Donc, c'est très important. Et en fait, on le fait pour permettre à chaque individu, à la communauté qui est notre interlocutrice, de pouvoir prendre elle-même les décisions qu'il faut prendre. Donc, on n'est pas dans la perspective de dicter aux gens ce qu'ils doivent faire. Non, on doit plutôt leur permettre de donner les atouts. On leur donne les outils, les moyens qu'il faut pour prendre les décisions. Donc, vous comprenez que là, nous sommes dans une perspective de promotion de la santé qui ne dicte pas les choses, mais qui donne la possibilité aux gens de pouvoir prendre des actions pour leur propre santé, leur communauté et leur famille. Donc, voilà, c'est ça ce que nous sommes en train de viser ici. Et parce que vous avez l'exemple de la COVID-19, si jamais vous prenez les décisions à la place des gens sans les concerter, vous savez qu'il y aura de rejet et de soulèvement, comme on en a eu dans beaucoup de cas. Oui, COVID-19, mais moi, je veux manger et donc ton affaire, ça ne passe pas. C'est pour ça qu'il faut faire attention. Et donc, c'est clair que nous allons utiliser cependant des outils ou stratégies, les tactiques de communication que nous connaissions, y compris les médias, donc les médias sociaux et les campagnes d'information, de sensibilisation, mais aussi beaucoup plus des stratégies d'engagement communautaire, d'action sur les déterminants des problèmes en cause pour pouvoir aller ensemble régler le problème. Et donc, il y a 5 domaines que vous devez savoir. Quand on dit communication des risques et engagement communautaire, vous devez penser immédiatement à 5 domaines. Tous les domaines sont importants et c'est parce qu'on doit commencer par lister qu'on a mis un après l'autre. Sinon, même la région africaine a dit, quand vous mettez en place le comité, le plus important sera d'engager la communauté. Vous voyez, donc c'est ça. Or, ici, vous voyez qu'il est en 4e position. Alors, ici, vous avez d'abord le premier domaine qui est celui du système de communication des risques en situation d'urgence. Donc, on va expliquer tout à l'heure. Donc, je vais y revenir. Le deuxième, c'est la coordination interne et des partenaires pour faire face à la situation d'urgence. Le troisième domaine, c'est la communication publique. Et le 4e domaine ici, c'est l'engagement donc communautaire. 5e, et donc si vous allez voir tout à l'heure, ce serait même parmi les premiers à mettre en place, c'est ce que nous allons appeler en résumé la gestion des rumeurs, prendre en considération la perception de la communauté. Vous voyez donc ce qui veut dire qu'un problème qui se pose doit être contextualisé parce que les perceptions ne sont jamais les mêmes d'une communauté à une autre. Donc, et les comportements à risque et la désinformation, on doit tenir compte de ça. Voilà les 5 domaines. Very, very important to consider these 5 domains. OK? Le premier domaine, c'est celui, nous avons dit, des systèmes ou du système de communication sur les risques et engagement communautaire. Qu'est-ce que cela veut dire? En réalité, c'est que nous devons avoir un comité dans notre système qui s'occupe de gérer les situations d'urgence. Mais
to manage emergency situations. These systems, we have to put them in place once we are faced with an emergency situation. And we need to do it while we are experiencing peace. And this needs to be a committee which is multi-sectorial in nature and about risk. We just not to create a committee that is going to take into account issues of COVID-19, etc. No, because we are always faced with the different situations in our region. We need a multi-sectoral community,
les ressources nécessaires humaines,
committee that will have all the required human and financial material resources with a budgetary line in all times, be it when we have peace. So this is what is required. It's not a committee that needs to be set up once we have an emergency, but we have to create it when we have peace. And it's a committee that is supposed to function all the times. And the required materials are provided. So the committee has to function all the times. And once we have emergencies, we ensure that we have put aside the required resources, be they human or financial resources, and maybe have some additions. That is very important. Secondly, like I was telling you, the AFRO region saying that we need to ensure that we engage communities so that we can solve our problems. We cannot come and tell the people, go ahead, this is what you need to do, etc. We need to have community engagement. We need to understand it fully. It is actually a theme that relates to community participation. You find that we need to ensure that communities or individuals are fully involved. And we need to look into 3 items that are very important, and they are already appearing here. You need to base your arguments on 3 things. Firstly, there is an issue. You need to put that issue on the table. And you let the community to organize things themselves. It also means that you have to give them the required skills to do such things. This is about capacity building for the communities. So the first one, you can call it community control. You have got nothing to do but to accompany the community so that they can do things themselves. That's how we engage people. So that we can achieve our objective. So this gives out what we are calling a self-esteem for the community, especially on what they do. And also, once you are gone, they are also able to continue with the same activities because they have the expertise. So they need to be involved as communities. And to do it, we have to strengthen community capacity, because as you know, communities, they don't know everything. But if we take the example of COVID-19, if you don't put it to the community and you don't involve them in developing strategies, I don't think how it's going to work. So what am I saying? So there are other situations that are always lived. We have also seen in the past, especially the case of Ebola, people used to go to the community. And I think it's the same thing. People are being told to wash your hands. But the question is, where are we going to find water? So if you go to the communities, you need also to think and see how we can solve problems. Because people are always faced with other challenges. You need to understand what would be the priorities for these communities. Don't think that what is a priority to you is going to be a priority for the community. In fact, the science has shown that in terms of health, if people, for example, say they do not have water, they have not eaten, and if you don't solve that problem, you're not able to solve the problem relating to COVID-19. Or maybe if you give food to people, and of course it's not you, maybe they will tell you that they're going to organize themselves so that they can get it. So those are some of the issues that affect the communities. So don't take your problem and say, we have been paid to do this and that. This is what we only need to do. You have to present the issue to the community and ask them, how do you think that we can help you to solve this problem? Where do we need to start? What are the problems that were there before? And what are, according to you, priorities? That's where we need to start. In fact, health professionals sometimes think that when they present issues that way, people will have to stop what they have been doing as a community. That is not right. That's not correct. So everything is linked to health. And this is why you need to present issues to them and tell them, these are the situations where do you want us to start? This is what we are calling community control.
Donc les trois, community control, community capacity building et community building. Ça fait les trois critères qui engagent les communautés. Vous voyez, très bien. Quatrièmement, donc on a troisièmement maintenant, la communication publique. La communication publique, vous savez, ça va utiliser toutes sortes de...
It uses all manner of communication strategy that you know. For example, mass media, social media. So you must be in the perspective of working in partnership with the media, the press. It's not in emergency cases that you do that. When you have a health system in place, you must work in partnership, in collaboration with the media, with the press. And when there are situations of emergency, you call them to say, look, we have an emergency situation. You explain to the press what that means and how the press must put the problem or place the problem on the table of the public. So people need to be trained. So we should use the media, the press that are very popular in our countries, because people accept certain media houses and reject others. They have greater confidence, trust in certain media houses. So these are things that will help you to position yourself and the things you do right before the public and help the public when there are emergencies. And it's very important indeed. That is the fourth area. Perception, risky behavior, disinformation, misinformation. You may not hear that we are looking at rumor management. Rumors. People think rumors is bad. No. Rumors. It's an indicator that shows, that tells you the scope of your action and the impression that people have of your work. So when there are rumors, please work on the rumors right from the beginning. As soon as you start intervening, so you must have ways of tracking the rumors right from the beginning. If you are, the green number, a way of collecting data information, there'll be panic among the people. So you have to record all that and be able to analyze them. But if you are in community engagement process, then be sure that people have trust in you, and therefore you can do tracking. But in our present situation, where there's no trust between the community and our health system, it means you will gain nothing. That is why we need a community engagement permanently. You should be able to do tracking, monitoring. So if you manage the rumors well, then we'll teach you how to manage rumors. So all these measures will help you in your intervention with the community. The last area is internal coordination with partners. You know that when there are emergency situations, there's panic everywhere, general panic. And there's pandemonium. So we want people to help us, all our partners. You see the last case in India with a variable, the whole world rushing to help India. It's not bad, but we need coordination. Coordination is needed. There must be coordination. One voice is needed. You see, we should act like one individual, one voice. We need internal communication. You need coordination. You must do things right within our own teams. We must do our homework in our own agency. Who is going to speak? It is not the central authority necessarily because of its function, but the spokesperson, has he or she been trained? So the spokesperson must have been trained. It's not many people who should go out and talk here and there. No, people should be nominated and trained in terms of peace. So it is these people who will speak for the agency. And there will be general coordination. Now, when there's internal coordination, it also means that partners also must be coordinated for everybody to know the role they must play specifically, so that together we'll have harmony in the way we are going to deal with the emergency. This is very important to know that the two go together, internal coordination and coordination of partners, partner coordination, so that we work in harmony and scientifically to manage emergency situations. So, grosso modo, this is the overview of the area that we're going to look at in depth in the 3 days. I thank you for your attention.
You may have, okay, we said that, yeah, we said that at the end, we have a moment for questions and clarifications, but people can actually put their questions on the chat box, actually. Then we get there, when we get there, we collect all of them, and we can also get questions directly from the audience. Thank you.
Yeah, thanks so much, David, for that good presentation. Just to give an overview in terms of the RCCE, and you have ended up with how we are going to manage the rumors. And just as David has mentioned, yeah, let's use the Q&A function to ask any question if you have. And also, there is an email that we are supposed to send the field pretest. So once you complete the pretest, you have to send it through email. Mention your, you can save it with your name at the end so that we can be able to track who has filled the pretest. Remember that at the end of the 3 days.
Thomas, I'm sorry, but I find it difficult. I still don't have the pretest form. I don't know what's happening. I cannot still locate it. I sent several messages, but I don't have it up till now. Thank you.
All right. If you check on the chat, there's a link which you are supposed to download the pretest, both in English and French. So once you download, once you fill, you should save it using your name and send it back. I think the link has also been reposted on the chat. Download the form, fill it, and send it back. Remember, at the end of 3 days, we are going to give out the certificates. So make sure that you fill the pretest. Moving on, let me call again David to talk about fundamentals, social determinants, and context. So over to you, David. David, are you here?
Yes. I'm sorry, I lost my connection for a while.
All right, that's okay.
Yes.
You can proceed with the second presentation. Thank you.
Oh, great. Okay. Let me share my screen then. Okay. Now we are going to look at the contextual dimensions of an emergency situation. in order to handle it adequately. Okay, first of all, the learning objectives, you have to explain at the end of this session the rationale of knowing a community before any collaboration that intends to improve health, to consider the community context in any public health intervention, to be prepared to enter adequately into a given community, because it is not the same procedure from a community to another. So you have to know how you enter into a given community. Want to explain the process of establishing a strong collaboration with communities. In fact, the question we do have to answer, as we are health professionals, is to know why are some people healthy and others not. That is the big, a huge question we do have to answer as health professionals. Why are some people healthy and others not? Why are some people have frequently emergency situations in health, like our African region, and others not? That's the question we do need to answer. And when you look at this graph from our colleagues, WHO colleagues, in fact, it is a matter of the health gradient. You know, we used to tell people, you have this, change this, and awareness, communication, and this sensitization. But all these are individually oriented preventive action. And when a given situation is on the ground, it is not because only of the individual, it is also the context. Because according to your context you are living in, you do not have the same situation because the contexts are different. And if you have this kind of context with poverty, poor housing, unemployment, inadequate food and nutrition, lack of education, we say analphabetism, and environmental health hazards, how can you be able to have ears who hear what people are telling you? It's not possible. You cannot, because you have already a load that is very, very heavy to deal with. So you cannot hear anything people are telling you. That is the main reason. And Albie George, he said, when we consider epidemics or emergency situations in health, he said, no epidemic has ever been resolved by paying attention to the treatment of the affected individual. You see, so that when we have an emergency situation in our field, it is not when you are on the ground counting those who are affected that you can resolve the situation. Never. You cannot do it. You cannot make it happen. So you need to collaborate with people to know what are the root causes of that situation so that we can address them together. That is the only way you can succeed, overcoming a given emergency situation. Let me give you an example with NCDs. We all know actually that the root causes of any non-communicable diseases is, the risk factors are 4: alcohol abuse, physical inactivity, smoking, unhealthy diet. But when we have our different programs that are dealing with the same situation, but not considering these root factors, we call risk factors. You see, that's why in our region, we're still dealing with these NCDs unsuccessfully, because we are tackling cancers by doing all we know about how we prevent them. But we do need to gather our efforts and deal with these risk factors we know as the main risk factors for the whole NCDs. Then we can succeed, you see. So when you are facing a situation, it is better to know the root causes and to deal with these root causes. So the diseases which are like leaves will fall down. That it is actually. And we do need to know actually how we work to deal with root causes of any health issues we do have. That is it, the key actually. And WHO provided us with this graph, which is explaining actually the way we should go about any health issues, you see, because if we want that the impact is health and well-being and equity, we do need to go further how our community is organized, not only at the individual level, no, because you can see that we have the social determinants of the situation. And as you can see here, the health system is somewhere there, but not the main responsible for all the health situation. No, even some studies have already shown that more than 90% of health situations have their causes outside of the health system, you see. So, and those social determinants of health have also their root causes elsewhere. The way our societies are organized to put each individual or communities on the social ladder, you see, and which is by through education, occupation, income, and gender, ethnicity, racism, you see. And those are the social determinants of health inequities. And these are, in fact, the consequence of how our nations are governed, or the governance, the macroeconomic policies we are using in our social, the larger community scale, the social policies, labor, market, housing, land, how our population are installed in the land we are using, and the public policies, education, health, social protection we do have in our countries or not. All these social, economic, political contexts are the drivers of the situation we can have in a given country or context. So we need to go further and to change things, more further so that we can get results. And so how we do things, what do we do to address social determinants of health actually? En fait, il nous faut savoir que, par exemple, dans la perspective...
We must know that in social determinants in the Sustainable Development Goals, that is globally, we need to know that from what we have seen, if we want to achieve our objectives, we must respect the 4 major pillars that the World Health Organization has put in place in the perspective of health promotion, which are good governance, not governance of the health system, no, but national governance, clean cities and towns, movements that we call towns, villages, and literacy in health. So it is these three elements that will help us to solve the problem of improved health of our peoples. And this is crucial. If you take our health systems, let me assure you, it is for sure in dealing with our health problems. And that is the problem that we are faced with. So how can we change things for the better or act on health determinants? We don't need to need the context. The context is crucial. We must know every context, but every context has these specificities. It's important because indeed, when we talk context, when we say context, it goes beyond our geographical areas. It also involves elements socially, geographical characteristics, social characteristics, and the dynamism in the relationship that we have. All these things are elements that we must take into account when we talk of community. When we talk of community, we must know that these characteristics are, in summary, there's a space dimension. There's also non-space dimension. The two must be integrated. The social integration. And then you see, we have dimensions also that concern needs of all Alexandria. It's all these things together that we must lump together to characterize a community. Let us look at the geographical context. It is true there are a number of elements, factors that we must take into account. But let us know that together, people have orientations, inclinations. What are their interests? What brings them together? We have diversity through individuals in the community. People are not the same, but we must take advantage of the differences to promote things and do wonderful things instead of the differences dividing us and creating problems for us. That is why when we want to talk for the community, everybody must be there. Everybody must get involved. Everybody must be there. So that we'll have very different views and then have the general viewpoint of the community. When we have to talk community, what are the objectives of the involvement of the community? We want to involve the community. What are the objectives? What's the result? The objective, the reason for involving communities is to know the context better and therefore be able to empower them. And so you need networking. Oh, you know it better than I do. That is peer education also. Celebration, the intellectual set, we call it some zero and non-zero. That is, someone has power, another person doesn't have it. The power that I have, I must share with the other person who doesn't have it. And we together, we move forward, we build. That is the zero and non-zero sum. What do we call empowerment? What do we call empowerment? Empowerment, indeed, is a process by which populations have advantages, they work together to have control over events or an obstacle in their lives. So they come together and they can now address the problem. So if we are able to make the community understand the process, there's no community that doesn't want to have problems solved. So we must target people, individuals, small groups, and the community in its entirety with partners, with the right partners. We cannot do it all alone and do it well. So we have to look for the right partners, and that will make us do social and political activities to solve problems. That is the continuum of community empowerment. In the intellectual element circle, we have a principle. That is the principle of the Manival in French. This principle is not with that. That is not what we need to deal with communities. But we as professionals, here, for example, we are health professionals, but the community are not at 0 point. They have power, but very low power, because they don't have trust in themselves, because they don't have knowledge, because they don't open up to the outside world. But we have studied, we've gone to school, we've seen a lot, we've read a lot. So when we go to them, we should communicate what we do to the people. That is why I'm saying that we need capacity building for communities. Give them what you know, and you leave them alone to act. You empower them, and they act. And while they act, they will grow knowing and acquire expertise and competencies. And then you now reduce. You see, gradually you phase out. And then the community now is used to working together, solving their own problems. And so when we are no more on the scene with them, they are okay. They have the competence, they have acquired the competence, they've gleaned knowledge, competence, expertise. So the community becomes the major actor of its own health. So you see, that's the leverage. You know, with a car, you take off. You know, you use the lever. Lever controls the car, and then you put it in gear and it goes. That's what we should do. We should teach people to solve their own problem. We should teach people to fish and not go fishing ourselves to give them fish. Empowerment will enable us to have greater control over what people have. So they will be able to have greater control over their own destiny. And I will improve the commitment and community participation. And it will enable people to have trust in themselves, so they will do things by themselves. That is human nature. They will be able to organize themselves and then strengthen themselves to solve their own problems. And they will establish social links because they have succeeded together. So they have confidence in themselves working together. And they will increasingly try to come together, work together, because they are used to doing that already. And that's very important. So quickly, when we come to networking, there are examples that prove that yes, networking, yes, but context-written groups, formal organizations, and institutions,
which in turn affects what people do, how they feel, and what happens to them. That is right. Who is saying this? A network is a structure of relationships linking social actors that in turn are the building blocks of human experience, mapping the connections that individuals have to one another. So actually, we do need to build that kind of relationships in communities so that people can be working together friendly, so that they can face any issue they may have on their way going, you see. So that's what we need actually to do with our community. And when it comes to peer education, you know all, I don't need to stay long on this because you all know what it is about peer education. And then because it is easier for people to share what they know within colleagues, it is easier to do so. And what I call zero and non-zero sum is that, a zero-sum situation exists when one can only possess an X amount of power to the extent that someone else has an absence of an equivalent amount of power. So I have, you do not have. But actually, that won't be a problem, actually, because we can share this power to win a situation. So power is often interpreted as a finite entity in which one person, group, or organization has influence and mastery over others. Zero-sum power creates a win-lose situation. And we know that in our situation, when we are facing a health issue, we do need a win-win situation. So my power over you plus your absence of that power equals zero. That's what we call zero sum. So we do need to add our power because as health professionals, we do have some power invested by the government and also by our knowledge, we do have power. And when we are together with a community, it is not the same type of power we do have. So we do need to share this. We have power with them so that they can be now powerful to face the situation when we are not even around, you see. And then I win and you lose. That is, for you to gain power, you must seize it for me. If you can, you win and I lose. That is the rule of power. And we all know what they say. If you want power, you have to seize it. Because power naturally is not something we can give to people. But as health professionals, we do need to learn how we share our power with communities. You see? So it is important to understand that power has to be gained or seized by those who want to achieve it by raising the position of one person or a group while simultaneously lowering it for another person or group. So we do need these kind of techniques to let people gain now power, because if we say, okay, you have to seize it, and they don't know by which way they can do it. But we, by going to them and tell them this is the way you can go to seize the power you need to tackle this health issue, then they can do it. Knowing a community actually consists of, to know their values, their assumptions and beliefs. Actually, this graph explains to us what it is about health. You have health, a healthy person, but in fact, there are many, many, many situations on the ground there, which are actually leading this health we have, the status we do have actually of health. So we need to know that there are values, assumptions, and beliefs. And among them, you have education, social support, income, and social status. You can go through all this. So health is not only about healthcare. No, there are many, many other situations over there. So we have to look at all these together. We are not in charge of all of this. It is correct, but we have colleagues from other sectors who are in charge. So we have to do what we call health in all policies so that they work with us together so that we can achieve a healthy situation. And values are For instance, income and social status. You can go to, this idiom saying healthy, wealthy, or unhealthy, unwealthy. So whenever it is possible, we have to elevate, the social status of our population so that they can become more healthier. And assumptions, social support network, social environment, personal health practices, and coping skills, you have to develop all these. And beliefs, it is, for instance, education, physical environment, healthy situation, healthy child development, gender. Like, for instance, when you see this picture, people living here, you can have malaria with child malaria. And these people, they can tell you, no, it is a witchcraft who gave favor to my child. It's not true. Witchcraft is already here. So you have to let them know how it is possible to clean this environment so that they avoid actually mosquitoes and be healthy from malaria. You see, so also you have to work together with communities based on their assets, because communities have some assets. You have to start from there, what they know, what they do have, so that you can let them know that there are someone also, they have some strength also. So we build on those things they do have in order to let them be the owner of the victory we have ahead. Also, we have health services, and we have to improve what we do have, actually, resources and services that are available, healthcare system, our community perception of the health system, because in some countries, our health systems are not up to the community level. No, we do have something over there, but we do not have skills, human resources at community level. So all these need to be strengthened, in fact. In order to avoid, so we have to strengthen all these, and knowing the context, we can avoid then the one-size-fits-all approach. Parce que les questions au niveau urbain ne sont pas les mêmes au niveau rural.
Issues at urban level are not the same at rural places, because people in rural areas have got many problems in terms of infrastructure and also in terms of housing as compared to very urban areas. So those are different situations that we have. We have also cross-border issues, like with COVID-19. We do not have borders now in Africa. What we have in Africa is porous borders, and what they have done is to close the borders, but what we have done is very little. So basically, how can we ensure that we get into the community? We're going to discuss it very quickly. We're almost at the end. To get into the community, we need to get prepared. We need to know how to enter to a community, and to enter there, we need to make some preparations. We need to have the appropriate documentation. We need to have the documentation. We need to work and ensure that we understand the community. What is the culture in that community? How do people behave there? What is the language? What are their means of transport? Food as well as accommodation. And once we are ready to go to the community, we need to understand also whom do we need to talk to so that the community can believe us. Who are the kings? Who are the speakers in those communities? What are some of the protocols that needs to be observed so that we are not rejected and thrown out of the community? So you also need to ensure that you announce your reason of going there and also understand the sort of language that needs to use. So those are things that you need to learn before getting into a community. We need also to know that we know that our health system is not fully reformed. We have a lot of things that we have done, but we also need to do more and ensure that we have an increased collaboration with our communities. And if, for example, we think of doing sensitization, this will be based on determinants. There is a project that was done in Canada. It was called the In Motion program. It was talk about physical activities to people. We did sensitization everywhere. But when we looked into issues, when we did our assessment, they said 57% said yes, they have heard what we said. But 18% said yes, I've been thinking about that. I will soon start doing physical activity. But 30% said they had been more active, but it didn't change much, especially in their life. And there was no influence, especially when it comes to socioeconomic conditions of people, especially the adolescents, as well as indigenous populations. They did not have any feeling or buy-in of that. So this means that the program did not take into account the special context of the people. The program did not involve them. They did not look into different environmental situations or contextual situations. Those are things that needs to be taken into account. You need to understand people before you enter into their community. For example, with our current situation, we need to look into the root causes. For example, when there is no clean drinking water, there are no toilets, there are no proper living conditions. We need to ensure that those problems are solved. For example, if we take the case of children, each child who is born is born in conditions that can determine his or her life. So conditions are usually very different. It is important to take into account most of these aspects. I'm almost towards the end. And once we get to a community, people are not always at the same level as us. They might say things that we didn't expect to hear from them. But as you go to a community, you need to get prepared that you'll hear things that you did not expect. We have to be ready and be prepared and not get frustrated, because when people have malaria, they tell you it's actually the witchcraft that has affected my child. You need to work with the community and also show the people that indeed the witchcraft could have been behind the house, and which this case refers to the environment. We need also to understand that the future means indeed to work together with the populations, to have a common understanding, a common thinking, what we call out of the box, so as to work together with people. And it's very important. It is also important to ensure that we come up with intersectoral work. What I called health in all policies, and create an environment that is supportive in nature, and that can indeed support top-down approach. But of course, they look into bottom-up actions. So basically, this is what I wanted to say. And if we take into account and take on board all these notions, we'll be able to win the war at community level when it comes to the issues of health. Thank you so much indeed.
Wonderful. Thanks so much, David, for the two presentations. And just a reminder that once you complete your pre-test, you have to send to the email addresses that have been shared on the chat. Indeed, beyond health, there are other factors also that help to facilitate our health, the socioeconomic and other sectors within that. So we really need to collaborate and also ensure that the communities are part and parcel of the solution to their health. Moving on, let's have the last presentation for the day by Aminata on risk communication systems. And just to, as Aminata is coming, let's use our Q&A function. Q&A function to ask any question. And for those that have not received the questions yet, we are still giving a grace period because of the technical hiccups that we had. So let me request the Secretariat to send the link again, but we should be able to close in the next 15 minutes. So let's share the pre-testing link and the emails that we need to send to. So let me hand over to Aminata to take us through the risk communication systems for emergencies. Over to you, Aminata.
Good afternoon, colleagues in the risk communication field. Can I confirm, can you see my presentation?
Yes, we can, and we are audible.
You.
And you could just go full stream, please.
Yes, but I would have loved to request that we give 1 minute just for people to stretch out, and we'll start in 1 minute's time. Please just stretch out, take a quick break, stretch out, shake your body, then we shall start.
As you stretch out, we are still sharing the links for both the English and French version of the pre-test and the emails that you can send it back once you have filled it out. My colleague Addis has been sharing that, so just look through the chat. You will see the links, both the links and the email. I can confirm that I'm receiving a lot of the forms back, the pre-test forms back. That is great. So if you haven't sent yours to any of the email, please check in the chat. The emails are there, and as well as the forms you can download, fill it in. At least like the chairman of the day said, we are going to close in the next 15 minutes. So please make sure you've done that. Thank you.
Thank you very much for stretching out. Aminata Kobi, I'll be presenting on risk communication systems for emergency. As has been said by Professor David Wetu, that in our region, we are faced with a lot of emergencies. The COVID emergencies are emergency that has affected all regions, but in Africa, we have several emergencies. Even as the COVID outbreak pandemic is ongoing, we still have other outbreaks that are still ongoing within our continent. Just a reminder of the 5 steps for risk communication. We have risk communication systems for emergency, internal and partner coordination for emergency, public communication, communication engagement with affected communities, perception, risky behaviors, and misinformation. At the end of this presentation, which I hope we'll be able to go through quickly, we'll be able to identify risk communication system in our agencies or countries, list possible ways of staffing, which include surge capacity during emergency, list training needs and opportunities, request appropriate budgets for systems implementation, test and improve our plans. So we'll be looking at the systems again, HR, training, budget, and testing. Importance of risk communication in an emergency system. Our emergency response can be incredible, but if we don't communicate well with the public, it will be in vain. Everything that our emergency responders have done will have been for nothing if we don't include communication as part of our response. Risk communication should have designated role in global and national emergency preparedness and response leadership teams with well-defined roles and responsibility for communication personnel. Risk communication should be considered as a functioning pillar placed at the national leadership structure. It should be integrated into existing national and local emergency preparedness and response structures, including building capacity for risk communication. Development of laws and regulation policies to support risk communication. I'll come back to this in a minute. Risk communication systems include human resources and training. As you can see with the COVID outbreak, we realize that information alone does not change people's behavior. We need enabling policies, not only within the health sectors, but within other sectors. And also we need an enabling environment to help people make healthier choices, easier choices. We need to have a system that is fully operational at national system with formal government arrangement, including multi-hazard, multi-sectorial emergency risk communication plan. The plan is very important. We cannot have a plan. We cannot implement risk communication without having a plan in place, including standard operating procedures on what to do. There should be a dedicated core team which is responsible for this area with reasonably skilled, trained personnel and volunteers. Financial resources cannot be overemphasized. And that is the challenge we have in most of our countries. We realize that other sectors, other pillars are being given funding, but risk communication, they think it does not need a lot of money. And I can tell you from experience, it is the most expensive aspect of responding to outbreak. As evidenced by a stimulation exercise or tested during a real health emergency with integrated lessons learned into the revision of the plan. There should be testing of our plan, exercises, and we need to learn from these exercises to improve on our system. There should be formal arrangements planned with standard operating procedures, human resources that are trained, financial resources, and a simulation or testing exercise. Many activities needed to make risk communication system effective. Who is responsible for ensuring it is done? Are there regular funding for these activities? Are there sufficient number of trained personnel with skills required to carry out these exercises? One of the challenges we face in risk communication is that people think that as long as they can talk, they are trained to do risk communication. It is a special field that needs a lot of training and also a lot of practice to be able to implement. It does not mean when you can talk that you are able to communicate properly. It should be fully operational system established with government arrangements, including a plan and a core team. We cannot overemphasize this. Such capacity. Now we see what is happening in other countries where you have a lot of cases. Fortunately, not in our region, but even in our region, we have countries like South Africa who have a high number of cases, Kenya. We need to plan in our countries. If there is going to be an upsurge of cases, how are we going to handle it as a team or as a country? So you will see the example of Thailand, which you will see when you receive your slides. Such capacities, the ability to increase available resources in response to disaster. So the same number of people that will be addressing, let's say 1,000 number of cases, will not be the same when there is an upsurge. There needs to be a plan to address upsurge of cases. What works globally activate press office and health promotion or community mobilization team at national and subnational level, and to be sure there should be a leader. If large emergency, national response takes over, but health risk communication leads communication response methods. Have a trained consultant or medical nurse students ready to staff hotlines and response desks. Have a risk communication or community engagement leader for all of these sectors. Best practice is to develop a plan beforehand and also to be reviewing the plan periodically. I know in a number of countries, the same plan they had before has not been changed, but it is realistic to be reviewing our plan even as the situation changes. The information we had at the start of the outbreak has changed. So definitely our plan should change. And the way people have been reacting to or responding to the outbreak has changed. One of the biggest challenges we had is change of people's behavior. We know that in a number of countries now, the use of face mask has been reduced, physical distancing is not happening, and washing has been reduced. So we need to change and revise our plans to address these issues so that we protect our population and our people to prevent an upsurge of cases. Prepare and organize risk communication training for peacetime, for emergency. We really need to have risk communication people that are trained, even if there is no outbreak, so that when there is an outbreak, we are properly prepared. So some of the JEE question, joint external evaluation that is being asked by WHO doing IAI evaluation are, is there a functional risk communication in the country's national response plan? Are there communication personnel or government departments that are formally responding to the public information needs during an emergency? Is there a permanent or surge staff dedicated to risk communication during emergencies? Are the roles and responsibilities of risk communication staff articulated in a response plan? Are there significant improvements that could be made in the staffing platforms, financial resources, and are there shared communication plans, agreements, and standard operating procedures between response agencies and public safety officers? So the 5 steps of capacity building package looks at, it was launched in 2018 and it looks at the 5 various steps. Steps 1 looks at the training, step 2, capacity mapping, step 3, writing a plan, plan testing, and adoption of the plan based on the local context. The training to be considered for training at national level. It depends on the country context. It may include from the Ministry of Health, health promotion staff, immunization staff, epidemiologists, and it should also include other sectors, including agriculture, environment, and Ministry of Home Affairs. It depends on the context. The training team, recommendations, RCCE should be integrated into existing national and local emergency preparedness and response structures. The preparation and training of personnel for emergency communication should be organized regularly and should focus on cross-agency coordination. For the training goal, there should be a goal, and at least it should be reviewed once every year. There should be a trained spokesperson. We should know the surge capacity if there is a big issue, and this surge capacity and participants should be trained at least once a year. And there should be quick guides and rapid training sessions to include community engagement or client staff. Training in designated emergency risk tasks and check the following. Telephone numbers, do all staff know about the standard operating procedures for clearance of processes and other procedures? refresh training regularly, including review and update of RCCE plan, discuss role, do simulation exercises, and train in incident management. Maintain the list of trained communication persons with specific skills. These are global documents that can be used. When training, you'll have access to these. There should be budget system to fund the training, and this budget needs to be approved. Funding, the plan for incremental building up of staff should be in place, and this should be activated. At least we should aim to have 10% of all the budget dedicated for risk communication. This also deals with budget, and the plan needs to be tested. Tabletop exercise can be done, or there should be a simulation exercise where there is no tabletop. There should be tests and drills to see if the system is operating properly. So these are examples of the types of tests and simulation exercises that can be done to test. Tests or exercise at least once every year. We cannot overemphasize this. And these are the resources that can be used to do the drill. It's in the WHO open exercise. The plan should be tested at least once every year. This slide looks at the different stages of an outbreak. There's a preparation stage, and there are things that can be done during preparation, initial response, the crisis and control stage, recovery, and evaluation stage. At the preparation stage, you can use that stage to develop the plans with human resources, build RCCE team, train the members. During the initial start of the outbreak, activate the plan, prepare such capacity. During the outbreak itself, manage the RCCE team and such capacity, ensure leadership and coordination. Monitor financial and human resources, collect lessons learned. Lessons learned on RCCE systems integration. One of the things that we really need to do in our country is to document the lessons we've learned from this outbreak so that we cannot repeat the mistakes again when we have other outbreaks. During the recovery phase, we can also document the lessons learned and keep them. Capacity mapping. We need to map the capacity we have in countries to prepare for an outbreak or for an upsurge. We have to look at multi-hazard, the whole of society approach, and potential and existing risks during outbreaks and response to emergency. This is I had to quickly go through the slides so that we finish. Thank you very much. This guideline was piloted in Burundi, Cote d'Ivoire, Nigeria, Rwanda, Senegal, and South Sudan, and we'll share with you the slides. Thank you very much. Over to you, Mr. Chair.
Thanks so much, Aminata. A very wonderful presentation. You have highlighted the risk communication systems, and it's very important also is to do the interaction review after maybe an intervention. We should be able to go back and check whether we managed to cover our plan or not. And the simulation exercises are very important. You can have the plan and to see how best you can be able to roll out is very important. We have a series of presentation. We had an introduction to RCCE, the fundamentals, social determinants and context, and lastly, the risk communication systems. I know that there are questions, comments, so we can use the Q&A section to ask our questions. So there's a question here from Abdara. Has COVID-19 changed what we knew and how we used to do RCCE? Is there lessons that we learned that are unique to COVID-19? So I will let Aminata or Dr. David to respond. And also, just to, as they are responding, If there are questions, comments, let's make sure that we use the Q&A function to ask. And also remember to send your field questionnaire, the pre-test, to the emails that have been provided in the chat.
I will start to answer, then I'll hand over to David. The COVID outbreak has not changed what we know about RCCE. It has further emphasized what we need to know about RCCE. One of the challenges we faced is that with the COVID outbreak, it has been a challenge to really engage communities. We cannot tell people what to do, rather we need to work with them to change beliefs. As you know, behavior change happens at the household and community level. People might know about preventive measures, but if you don't engage them and work with them to strategize on what they can do together with you, they will not be able to change. So now we realize that with the outbreak of COVID, we really need to give power again to communities for them to decide on what to do and work with us. If communities are empowered from experiences we had with other outbreaks like the Ebola outbreak in West Africa, when communities are empowered and you partner with them, they can put together bylaws, they can put together strategies, what is applicable in their own context to change the situation and improve response to the outbreak. Over to you, David.
Thank you so much, Aminata. Allow me to use the other language because we are both English.
It's perfect. It's perfect.
Good. Great. En fait, comme elle a dit, Aminata, normalement, la situation de la COVID-19 devait changer. Ce qui va changer là, c'est que ça va changer notre perception de la santé et de comment nous intervenons dans les activités menant à l'amélioration de la santé de la population. En ces thèmes que, en réalité, il faut toujours associer la communauté pour régler ces problèmes. Vous avez vu combien de dégâts il y a eu un peu partout quand les gens n'ont pas voulu tenir compte de ce que la population connaît et vit. Et c'est ça le problème. Donc, on ne peut pas régler on ne peut pas faire le bonheur de quelqu'un sans la personne. C'est ce que ça doit nous amener à comprendre maintenant. Nous sommes forts, nous connaissons beaucoup de choses.
David, please, yeah. Interpreters, please. Thank you.
Oh, okay.
Okay, continue.
Yeah. You know, so actually, we do need really to change the way we think health generally. And because COVID-19 is actually showing us that we need to compulsory work together with communities if we want to change anything in their lives. That is it actually. Because by not collaborating with communities, you go a wrong way. And you can see riots and, you know, situations that jeopardize us, actually, because they can stone us and, you know, destroy all we have. So we need to change the way we go about it. It is very critical that when we want to act or address any health issue, we need to work together with communities. And actually, RCCE should be the cornerstone of all we do. And don't forget, I'm a medical doctor. By saying this, I practice medical doctor as general practitioner and at many places in my country. And I can tell you, actually, I realized that we cannot improve health of our population without collaborating with them. It is critical. It is very important. Thank you. And il y a une autre question que Thomas a sauté.
There's another question that Thomas jumped. It was in French. The person asked clarity on the situation of zero sum that I used. That is to say, sum zero sum. Indeed, I mean that I have power, for example, I have power, but my neighbor doesn't have power. And that's the situation we live in as health professionals and communities. The communities are in a situation where they have little power. Knowledge is power. They have little knowledge, and that creates problems for them. We must know, instead of living staying in our ivory towers, we must understand that we must go to them and give them the possibility to, empower them. You see, power, you seize it, it's not given to you. So you should help them to take power, empower themselves, just like a child. If you want a child to do something and you are up there, you must come down to the level of the child. You see, you stoop low for the child to understand you. That's what we should do. And we should do it concretely. What does it mean? It means that we shouldn't go to the communities with our jargons. We should ensure that when we are with the communities, we should find the appropriate language. We should come down to their levels, essentially, for them to understand us. And we should speak the language that they speak. For instance, if they say that malaria is because of witchery, tell them, yes, it's not serious. But how will you kill this witch or wizard? How will you get rid of the witchery? So gradually you help them to find a solution together. Then they said, we were stupid. It wasn't witchery. It's the deaths, the trash that we're living with. So you have to be down to earth with them, find the right mechanism. But I'm telling you, I've lived on the field. So we told them, no, it's not witchery. It was our environment is dirty. You see, because we're not taking malaria seriously, fever seriously, and we live with death around us. So help them to get rid of the death, and then there they go. Thank you.
Yeah, thanks so much, David and Aminata, for the responses. We have still some questions. How do we ensure we lobby to get more funding for RCCE? Like you have rightly say, funding is usually not available, but you are expected to ensure behavior change takes place. This is from Sandra. And there's another question that is the RCC plan and strategy are the same. How can we engage policymakers in COVID-19 RCC plan? So over to you, colleagues, David or Aminata.
Okay, thank you. I can start, and Aminata come in later. So, in fact, actually, c'est très important de savoir que les fonds là.
It's important to know that the fund for RCCE is there. When we say we want to change behavioral patterns, we must know that behaviors change using determinants. So if we do our work, we help them to identify the determinants. If you go to them, you say, we want to change your behavior. We're going to do sensitization. We're going to use this and that to posters. We'll use radio messages. If you tell them this, you don't get the money. You don't get the money. But if you prove that the behaviors have determinants, and the determinants are in a number of sectors, but the money is in the sectors already to manage things. If you find that it's an education issue, the education sector, the money is in there already. So you must send people to school. You must educate people. You must deal with the root causes of the problems. It's the root causes of the problem that you must deal with. And not just do sensitization, use posters. If that is what you want to do, you don't get the money. But if you say that the people are illiterate, they need to be educated. So if we raise their level in literacy, then there's money for education, for literacy. Our constitution says that all children must go to school. If you're going to negotiate at the highest level, you see that there's money, and you are not, it's not you who are going to spend the money. The money will be spent by the appropriate sectors, and you will ensure that the work is done. Because if you take the money, if you touch the money, people will say, yes, you are going to actually embezzle our money. If you go to use radio messages and posters, you will not get the money. So necessarily you must get to know the root causes of the problems and identify the appropriate sectors and do advocacy in order to get things moving successfully. That is how, in my thinking, I think things should be done. Secondly, with regard to RCCE plan and strategy, when we say plan, it is strategic plan that we should say. When we say plan, we mean strategic plan. If it is strategic plan, if you say plans and policies are not the same.
And strategies, it is generally speaking, it is strategic plan for 5 years, and policies are for 10 years. Then strategic or plan here, it is the same. But I don't know whether you are putting there policy. Policy is not the same as strategic plan. No, but we used to say strategic plan. So it is the same. Thank you. Aminata, over to you.
I will not go over again what David has spoken about by the need for funding. One of the things we need to do as Geeks Communication is to do our best to be on the planning table. If we are not on the table where they share the cake, it will be a challenge. So I think we need to be strategically placed during the planning, and we need to be ahead in terms of our plans. Our plans should be well costed, and we should indicate evidences that it's going to take a long time, because one of the challenges we see as Geeks Communication, people want quick fix. Geeks Communication is a laborious process, and it does not, people do not change within a short time. So we need for them to understand that it's going to take a lot of work and resources for us to be able to work together with communities to effect change together with the community. Over.
All right, thanks so much for the responses. We have 2 more. I think then we should be able to close. We are 2 minutes to time. There is a question to say that people are only want to listen to WHO about COVID. How shall we go about this? This is from Tony from Uganda. And Lillian Luaga says that currently in some countries are registering key challenges to COVID-19 response: low community risk perception, declining uptake of preventive measures, comprehensive limited community engagement, and coupled with reduced resources to support the response. What is the best strategy? So I think we can respond to those 2, then we should be able to close for today.
I will respond to the last one, and David will respond to the first one about WHO. What we've realized is that there's a difference between telling people what to do and working with people to address the situation, and that is what we are facing with COVID. Now, people have general information, but they have not been able to internalize it about how to protect themselves. You realize that people are in crowded places, and they are not conscious enough that if I'm in a crowded place, I might be at risk. So I need to use my face mask. If I'm in the field alone or I'm in a car, I don't need to use a face mask. So that functional literacy for people to understand what to do in different situations, having that information is one of the key challenges we have. Secondly, there's an issue of enabling environment to support people to change their behavior. Example, legislation about use of face masks. I know a number of countries have put in place legislation to use face masks, but this legislation are not being enforced. And people in our authority are not living by examples. They make declarations, but they don't set good examples for people to see. So if the population does not trust what the leaders are saying, or what the leaders are saying is different from what they are doing, it affects people to change their behavior. So there's a lot of issues we need to look at. First, we need to understand what influences behavior change within our own community and within our own context, and use that information to change our strategies and our messages to the public. But also the issue of an enabling environment. If the max is very expensive, you realize that people will go about with dirty marks, or they don't use it properly and it's not effective. There's a lot of work for us to do as risk communication, especially when we see what is happening in continents like India, countries like India and Asia region. We have to be prepared, and we don't need to put our guards down. We need to prepare in our countries so that we are not caught unawares with response. Over to you, David.
Okay, thank you, Aminata. I say hi to Lillian, and I can say also there for her that actually we need to focus also on the root causes of these situations she is talking about, so that we can see with which sector we can liaise in order to deal definitely with this kind of situation. Like if you see low community risk perception, you see, it is a matter of social gradient. You know, low community risk perception is related to social gradients, because those who are higher